Hi, this is Philip Ador, founder of NCLEX RN 45-Day Challenge. In this video, I'm going to be talking about shock. So when we talk about ischemia, we are usually talking about lack of blood flow to a specific area of the tissue. So maybe like with the heart attack, a coronary artery in the heart gets blocked that supplies the left ventricle with blood. So that localized area of the heart tissue doesn't get enough blood and oxygen. And that damage is localized to the left ventricle. Shock is like ischemia, but on the global scale. In other words, it's a whole body circulation failure, where blood flow to tissues is dangerously low, leading to cellular injury, possibly damaging multiple organs, and even leading to multiple organ failure. So with shock, the body's tissues aren't getting enough oxygen to the blood. Normally, the blood perfuses through the tissues and delivers oxygen because there's enough pressure in the circulatory system to push it through. So blood pressure is a major determinant for the amount of blood perfusing through the tissues. Now, blood pressure is determined by two components: the resistance of the blood flow in the blood vessels, things like vessel length, blood viscosity, and vessel diameter, and the cardiac output, which is the volume of the blood pumped by the heart through the body per minute. And you can break that into heart rate, the number of beats per minute, times stroke volume, and the amount pumped out each beat. Going even further, the stroke volume is found by taking the total volume of the blood left over after a contraction, the end systolic volume, and subtracting it from the total volume in the heart after filling, the end diastolic volume. Alright? Now, keeping all those in mind, shock can be caused by a whole bunch of different things. But we can categorize the different types of shock into three main categories, along with the subcategories here and there. The first category is called hypovolemic shock. Hypo means low, volume refers to volume, and emia refers to blood. So hypovolemic shock is a shock induced by a low fluid volume of blood. And this could be either non-hemorrhagic or hemorrhagic. Non-hemorrhagic means that the loss of fluid volume isn't from the bleeding. So this could be like if you were stranded in the desert and suffered severe dehydration. Eventually, your loss of fluid and sweat would reduce the blood volume to where it would be enough to supply your body's organ, and you develop hypovolemic shock. Hemorrhagic hypovolemic shock, on the other hand, is a loss of blood volume through ruptured blood vessel. In other words, from bleeding. A loss of about 20% of your total blood volume, roughly 1 liter, can be enough to induce hypovolemic shock. And when that liter of blood leaves the circulation, the total volume filling into the heart goes down, meaning the end diastolic volume goes down. Right? This means that the stroke volume goes down, as well as which cardiac output goes down, and finally, when we see the blood pressure also goes down. When cardiac output goes down, catecholamines like epinephrine or norepinephrine, ADH, and angiotensin II are released, all of which can cause vasoconstrictions of the blood vessels, which increases vascular resistance and increases heart rate, which increases cardiac output, and then combined effects all increases the blood pressure. A super important indicator of tissues for not getting enough oxygen due to hypokalemia. It is decreased mixed venous oxygen saturations, or MVO2. MVO2 is the amount of oxygen bound to hemoglobin in the blood coming to the right side of the heart from the tissues. So it's like the amount of oxygen left over or not extracted and used by the tissues. So if blood volumes goes down, that means oxygen goes down, and there's going to be less left over, right? So MVO2 will be down with hypovolemic shock. Since blood flow provides heat to the tissues as well, when it's down, the skin starts to feel cool and clammy. Since blood flow provides heat to the tissues as well, when it's down, the skin starts to feel cold and clammy. And so hypovolemic shock is considered as a cold shock. A second main category of shock is cardiogenic shock. Cardiogenic means produced by the heart, right? So this is when something happens to the heart such that how it can pump enough blood to the body's tissues. The most common cause is acute myocardial infarction or heart attack. Well, the heart attack itself reflects ischemia, but these effects of the initial cardiac damage eventually leads to a state of a shock. When the heart muscle cells die, it can contract his heart, which means the amount of the blood pumped out or stroke volume goes down, and therefore cardiac output goes down as well. In the same way as with hypovolemic shock, the body releases vasoconstrictors to increase vascular resistance and help maintain blood pressure. Also with the hypovolemic shock, MVO2 will be down, since there's less oxygen being pumped out, and so less will be left over. Sometimes there might be an obstruction that doesn't allow the heart to fill properly with blood. For example, we might have the pericardial sac fill up with fluid from an inferior or blood from a traumatic accident like getting stabbed in the chest. If the sac fills up, it physically constricts the heart from expanding and contracting normally and also reduces the stroke volume. This is sometimes subclassified as obstructive shock, but you can see that the cause is still due to the heart from the ability to do its job, right? Similarly to hypovolemic shock, a reduction in cardiac output needs to lower the blood flow. So the skin gets cool and clammy, so cardiogenic shock is also considered a kind of cold shock. Alright? So the third main category of shock is called distributed shock, where there is typically a leaking of blood vessels and an excessive amount of arterial vasodilations or widening in the peripheral blood vessels, which remember is where the components of vascular resistance. If arterioles dilate, vascular resistance to the blood flow goes down and blood pressure goes down. Leaves a less perfusions and distributions of the blood organs and the tissues. The most common type of distributive shock is a septic shock from packages of the blood. What happens with septic shock is endotoxins. These are large clunky lipopolysaccharide molecules, sometimes just called LPS, found in the outer membrane of the gram-negative bacteria, causes of crazy cascades of events that ultimately lead to lower perfusions. First, disguised as directly damage endothelial cells and cause them to release vasodilators like nitric oxide. These also activate the complement pathway in the blood, which stimulates the mass release of histamines and other vasodilators. LPS molecules also activate immune cells like macrophages and neutrophils, which help create a bunch of pro-inflammatory cytokinins, like tumor necrosis factors and interleukin-1. These help the immune system destroy the invaders, but they also stimulate the endothelial cells to release more inflammatory molecules, like the platelet activating factors and the reactive oxygen species. All of these inflammatory chemicals damage the endothelial cells and increase their vascular permeability, making the blood vessels leaky. Also, endothelial cells expressive procoagulant called tissue factors. The procoagulants are molecules that increases blood coagulations or blood clotting. And this is a combination with an overall decreasing anticoagulants, which usually decreases clotting and seem to be often depleted or used up during sepsis. Leads to this increase in the coagulations and clotting into microvasculature. And of course, clotting in the blockages in the blood vessels further decreases perfusions. Right? Okay, so this is a widespread facial dilations, means very little vascular resistance. And blood can get a chance to unload as much oxygen as it cruises through the vasculature. And it gets back to the right side of the heart with the leftover oxygen. So in this case, as a post-cardiogenic, MVO2 can be normal or even increased. In contrast to hypovolemic cardiogenic shock, now there's an increase in the flow in the peripheral blood vessels. And the skin becomes warm and flushed. So the distributive shock is a kind of a warm shock. The overall combined effects of the widespread vasodilations, increased vascular permeability, and microvascular blood clotting, all contributed to the decreased perfusions of the blood to vital organs. Now, the second type of subtypes of distributive shock or anaphylactic shock, which is an allergic reaction that causes dangerously low blood pressure. A neurogenic shock with the nervous systems get damaged and can control the body's blood pressure. The treatment of shock depends on the cause. In general, the goal is to stabilize the blood pressure that the vital organs like the heart and the brain are perfused with the blood. In order to stabilize the blood pressure, fluid replacements and medications that increase heart contractility can cause vasoconstrictions and retain fluid can be administered. Oftentimes, a person might need a supplemental oxygen or have their airway protected,